My name is Karol Kremens, and I'm a pulmonary and critical care physician here at Essentia Health. I was lucky enough that throughout my early education and in high school, I had a fortune of working with very good biology teachers who really, I think, fostered my interest in biology, and that sort of evolved later into medicine. I chose pulmonary and critical care, like many of my colleagues, mainly for the critical care part of it. That's how a lot of residents actually go into that subspecialty, the allure of intensive care unit and the fast pace of a very challenging patient. And then throughout my fellowship, I also started to appreciate the pulmonary aspect of it and the bronchoscopy aspect of the pulmonary critical care field. What I like about people in my clinic and in the ICU is usually their stories. Everybody is different, and throughout my fellowship, I've developed an appreciation to people's stories. Everybody is different, and a lot of interesting life stories of what they've done in life, how they got to where they are. It's very interesting, and it makes the patient more human. It's not just a disease, but an actual patient who's had their share of problems, successes in life, and usually has one or two amazing stories about what they've done in life. First and foremost, if they smoke, to quit smoking. This is probably the most important thing for everybody, and it's never too late to actually quit smoking, no matter how long you've been smoking. If it's in the ICU, then the first thing I usually tell them is that yes, they're sick, and I'll be with them through very tough times, always by their bedside. And then going back to the clinic, if this is not a smoking problem, but emphysema or asthma, that yes, we might not be able to cure their disease, but I'll do my best to make them breathe better, make them live a little bit easier with their chronic disease. Spent time with my wife. Read to my kids. They're young, 4 and 2. Play with them in the backyard, and go to the gym and row. I enjoy rowing, so that's what I do. In the summer, sometimes on the lake, or in the winter, my basement on a rowing machine.